Hello students, we are on the chapter patient counseling. In our last class, we studied about definition of patient counseling, outcomes of effective patient counseling, patients requiring counseling, patients who should be counseled at regular intervals. In today's class, we will study on stages of patient counseling, barriers of patient counseling, strategies to overcome these counseling barriers. So the first one is stages of patient counseling. Patient counseling is not just you just go to the patient and talk about the medication. It is like you have to plan for this patient counseling. So you have to go, you have to prepare for stages of this patient counseling. There are 5 stages of patient counseling. Before you could go to the patient, you have to plan for all these 5 stages of patient counseling. The first one is recognizing the need for patient counseling. So first you have to identify whether you need to do the patient counseling on that particular patient. Pharmacist is a busy person in the pharmacy. His time is very important. Uh, he is the main person. He needs everywhere. He needs to be there like at every occasion. So he is a busy person. So there is a need to identify whether a particular patient needs patient counseling. So here the objective of the stage 1 is to recognize the need for patient counseling. So here the main intention is that the medicine or the appliance that the patient is using is safe and used effectively, right? The same need may also exist when the patient takes over-the-counter medication. You cannot just ignore that the patient is getting over-the-counter medicine or the appliance. If there is need, you have to also do the patient counseling in case of over-the-counter medication or appliances. So while recognizing for or the accessing the needs for patient counseling, the first step is to establish what the patient already knows. You need to understand or you need to find out what actually patient knows about the medication or appliance, and you should find out what he knows, what he got from the prescriber, or what he knows from the prescriber or the practitioner. Factors related to medicine and patient will make so depending on that, you can find out whether the patient needs the patient counseling or not. So by analyzing these various situations, so you're going to find out whether the patient needs the counseling or not. So second stage is accessing and prioritizing the needs. Right, you have to collect the information from various sources and you have to prioritize the needs. You have to find out which one you have to tell first, which one next, which matter is more important, which matter you have to discuss uh, for more time, which one to be given more importance. That you have to plan. So objective of this second stage is to access and prioritize the counseling and advise needs of the patient. Once the indication for counseling at the first stage, you are going to find out whether the patient needs the counseling, and then after that, when the patient needs counseling, you have to gather the information, the medicine information, patient information, and these can be obtained from either patient or caregiver or hospital or community-based healthcare professionals or the other pharmacists or clinical records. From all these sources, you need to gather the information. Also, the patient medication record, patient history by from other community pharmacists, or the medication history, including problem with the previous medication as well as over-the-counter medication. From all these sources, you are going to collect the information and you are going to get ready for patient counseling. So this is the second stage. In the third stage, specifying assessment methods. So here the objective is to assess points to be covered for counseling. You have to get ready with the plan that what needs to be uh, counseled, what points you have to bring in. See, there are standard points of advice. Apart from this, you have to you have to get the plan ready specifically for the patient to who you are going to counsel. It's not like counseling is just a general practice that you are doing. You have to tailor made the counseling for the given patient. So counseling barriers you have to remove here, like you have to introduce yourself, give explanation about the medication. You have to introduce patient to the medication. So all these you have to get ready with the mental plan on this process. Methods of checking the success of any counseling and advice will vary widely depending on type and complexity of the advice, the patient medication history, or even the patient medication, the current regimen, uh, current uh, bunch of medications what a patient is taking, that may be a complex in nature, right? So you have to gather information from stage 2 and you have to prepare for this stage 3. So, so you have to deal with a patient directly or indirectly, and the patient knowledge of uh, the pharmacist knowledge of the patient. You have to get all patient information and prepare a plan for the particular patient for effective counseling. So fourth stage is implementation, that is the execution of your plan. So here the actual scene is going to happen over here. Here you are going to execute the plan whatever you have prepared. You have to ensure that you yourself have proper knowledge of the patient condition as well as the medication that patient is taking. You need that skill over here, and you should be thoroughly prepared to carry out the counseling. Effective preparation for important functions should include consideration of patient expectation. You have to think in advance that what the patient is going to expect from you on the counseling points, and you have to be aware yourself that patient time as well as your time for the counseling. Counseling should be carried out, you have to carry out this counseling in a non-threatening environment. There should be enough space. There should not be anybody around, right? And you have to form a good relationship with the patient. Introduce yourself, patient, or to the patient or the caregiver. And there is a need to establish a rapport. You have to establish a rapport with the patient. You know. Um, and counseling and advice process involves how long it is going to take and where the counseling is carried out. You have to inform the patients. Request the patient, ma'am, we will, or the uh, male or female patient, let's go at this place and discuss about your medication. You can invite the patient to that place in a comfortable way. The pharmacist should allow enough time to complete the counseling. Pharmacist should not be in a hurry and give the patient counseling. You have to make the patient comfortable discussing with you. And if time is limited, the pharmacist may agree with the patient to spread the counseling over a number of occasions. If pharmacist doesn't have much time, and if pharmacist thinks that it is going to take longer time, you can schedule the counseling. You can also, divide the counseling into number of occasions, different occasions. So this is about the fourth stage, and fifth stage is the assessment. Anything, any such things are done, you have to find out whether how the how your plan is effective. I mean, how you have to assess the effectiveness of the patient counseling. Now you have already made the patient counseling, and for the next visit, when you meet the patient, you have to find out how your plan worked out. So you have to compare, you have to make comparison, you have to compare the out, output identified under objective in your objective with the current patient scenario. So if there is anything needed to be added, you can add that here. If the patient is not following, find out why the patient is not following the guidelines. Is there any problem with the following the guidelines? Did the patient understand? Does the patient needs to be explained more? So all these you need to identify. For a variety of reasons, a patient may not understand all the information or instructions or advice given they receive during counseling session. So it is important now the patient has come back to you, and it is the time for you to repeat your counseling advices to the patient by talking to the patient. So if required, so you have to give such information again. So this is the fifth and last stage of patient counseling. Alright, now here there are barriers for patient counseling, and we will go through these barriers one by one. So first one is patient-based barriers. There are three barriers actually: patient-based barrier, system-based barrier, and provider-based barrier. So in the first one, patient-based barrier means the barrier is with the patient itself, the patient related problems. Counseling happens only when patients show interest. Now the patient has to show the interest, right? If you are interested, and if the patient is not interested in listening because the patient is in hurry to reach home, or patient wants to go to another place before going to home. A patient doesn't have time for any other reason. So in that case, counseling is going to be a failure, right? So this is one of the barriers, the time barrier. The time problem is one barrier in that is patient related time. So that is one problem here. Then the gender difference. If the pharmacist is male and the patient is female and the problem are related, the problem is gender related, then there is problem going to happen. Even the vice versa, if the pharmacist is female and the patient is male and it is a gender related problem, then it is a problem because of the gender difference. Sometimes there will be a language difference. The suppose a pharmacist speaks English and the patient speaks the native language, and patient doesn't know English or cannot speak or understand proper English. So in that case, this is a language barrier. Then the literacy, the patient, you can give the leaflet to the patient. If the patient cannot read the leaflet, then that is going to be a patient based barrier. So these are the patient based barriers. Then the second one is system based barrier. Lack of reimbursement due to non-legalization of patient counseling. Actually, patient counseling is not legalized in India, but in many of the advanced countries, patient counseling is legalized. Means there is a law that pharmacist has to counsel the patient every time the patient receives the medication. At the same time, this counseling service is the government is going to pay for this patient counseling service, so that you're going to get along with your salary. But in India, it is not legalized, and the pharmacist is not going to get paid for this counseling process. So this is system based, system of that country, the law of law based barrier. So lack of adequate space. Sometimes what happens, there won't be enough space in the pharmacy to discuss. So this is also a system based um, problem. System means it is the system inside your pharmacy. You may not have enough space. There may not be trained pharmacist for patient counseling. That is going to be a problem. Suppose in case of a diploma, a pharmacist with a diploma in pharmacy, they may not have enough training in patient counseling. So this is going to be a problem, system-based problem with the trained staff. And the busy hours, sometimes the pharmacy itself may be very busy. Pharmacist busy with the dispensing the medication all the time. So in that case, um, the effective patient counseling may not take place, or patient counseling may not take place at all. So these are all the system based barriers. Third one is provider based barriers. Provider means you are the one. The pharmacist is the provider here. The problem with the pharmacist himself. So in India, majority community pharmacies run by pharmacists having diploma in, as I already told you, diploma in pharmacy qualification for their knowledge and their commitment towards counseling are inadequate. So the diploma in pharmacy, unless they are properly trained to do the patient counseling, there it may be a provider based barrier. So lack of interest to the pharmacist has to show. This is provider based, right? It is not patient based. If the pharmacist himself is not showing interest in doing patient counseling, so that is going to be provider based barrier in patient counseling. Then lack of time, pharmacist not having time, then lack of knowledge with the pharmacist, lack of confidence with the pharmacist, lack of training. All these are provider based barriers in performing patient counseling. So these are the three barriers of patient counseling. Now, how to overcome these barriers? Let's discuss on that. Strategies to overcome the counseling barriers. To overcome the patient-based barriers, so the points discussed here are with the patient-based barriers. Of course, one with the other two barriers, especially the system-based barriers, one with the law that needs to be enforced. The government has to bring the law that the pharmacist has to counsel each and every patient. Then the patient counseling is going to be more effective. Also, the government has to, pay fees to the pharmacist who counsels the patient. If this rule comes, like the one that is in Western countries, the counseling is going to be more effective. So these the strategies to overcome the counseling barriers are for patient-based barriers. So first one, using multimedia materials. See, here the farmers, if the patient is not going to understand properly, in that case, what pharmacist can do is he can depend on multimedia materials. Like you can use tablet, you can show things on the tablet, or you can use the phone, or you can use the laptop, right? You can use the laptops to show the patient things regarding information regarding the medication. Then pictograms, here you can see the pictures or the instead of saying, you can show the pictures, use pictures to make the patient understand on what you are saying. You can make use of these pictograms in your information. And then oral and written information, you can give the leaflets. You can orally say to the patient on how to manage with the medications, like tailor made, like you have to particularly say about a drug. See, when you have the leaflet, it is like in general about the medication, but in that case, in the cases like you have to specifically tell something, so you can tell that orally. So next one, compliance aids. Many patients will have a compliance problem. They may not take medication for several reasons. In that, forgetfulness is one, right? Or if the patient has got many medication, the patient may get confused. So here is one aid, that these are pill boxes. You have all the days in the weeks in here. So in these you can fill the medications of those particular days. See, some medication may be weekly once medication, some medication may be one that needs to be taken alternative days. Right, these medications you can put them in these pill boxes, right? and then this will help patient to take them on those particular days. And also you can keep, the patient can keep the reminders by using a timer, right? Or you can keep the alarm for a particular time the medication to be taken, and make use of these some appliances. Here is the picture, the child patient using metered dose inhaler using spacer. This is a spacer. This spacer will help the patient in inhaling that medication, the inhaler medication over here. First, from the inhaler, you actually press this on the top, this inhaler on top here, on this on the actually that is the bottom end of that inhaler. You press there and medication get filled over here in this spacer. Then the patient is going to inhale that through mouth. So this is going to help this inhaler is very small inhaler. It may be difficult for this child to use the inhaler directly over here. So this spacer is going to help. So this is compliance, one of the compliance aids. Here there is one more compliance aids. Some especially older patient, they have problem using eye drops. When they try to focus the drop to drop uh, on the eye, exactly on the eye, it uh, the patient may miss the point. This happens with the older patients. Their hands also maybe are shaking. So for that, you can use this eyedropper. So you have to fix your eye drop bottle into this eyedropper and keep that around the eye, and then press that eyedropper, so opening the eye, so that the eyedropper exactly will fall into the eye in that position. So this is the magnifying glass. Many older patients, they may not be able to read the given instruction from the leaflet. Always in the leaflet, the letters will be very small. The fonts are very small in size. So for that, the patient can use the magnifying glass to read those letters. So these are some of compliance aids that will help overcome the counseling barriers or the medication adherence problems. The next is follow-up schedules. As I discussed earlier, the pharmacist can schedule the patient counseling timing for the patient. Right, so in those schedules, the pharmacist can explain the patient regarding the medication. Then visual, that is the regarding scheduling. Then auto visual tapes, these are rare now. So previously they used to use audio visual tapes. You can audio visual or either audio tapes or the video tapes. So you can educate the patient using these audio visual tapes. So next is tailoring the prescription instructions. Of course, there are general instructions on patient counseling, but you can tailor make the instruction, particularly this medication, a specific medication for the particular patient. You can give a tailor-made prescription instructions. Then legalization of patient counseling. right? As I discussed earlier, the government can legalize the patient counseling. They can make it compulsory that the pharmacist has to counsel the patient on every prescription. So this is there in United States. That's why the person whoever helps in pickup of the medication has to ask the patient whether he or she has got any question for the pharmacist. They ask this because it is the legal. If the person whoever at the drop off does not ask this uh, patient whether he or she needs patient counseling, then it goes against the law, and the law comes in picture. The patient can complain that she has not been offered for patient counseling. So there may be legal action on the pharmacist on not giving offer for counseling. Then at the same time, one point is the legalization of patient counseling. Second point is um, fixing the fees for patient counseling from the government. Continuous professional development program, those needs to be done. Continuously, time to time, means like yearly once, the pharmacist needs to be, given training for patient counseling. These continuous professional development plans can be, done by the pharmacy, or even it can be of a government based, or government can bring the rule that the pharmacist has to go through once a year or twice a year patient counseling training program. So these are the important strategies to improve the counseling activity in pharmacies. So these are the strategies to overcome the counseling barriers. So this is all for today. Thank you very much, and let me know if you have any questions.